Hi everyone, thanks so much for joining us today. We have a lot of folks who are going to be joining the platform, so we're going to go ahead and give folks time to log in and get settled. So we're going to get started at 3:05. Everyone will be muted upon entry, so if you could go ahead and use the chat box to let us know if you have any questions or comments, and feel free to let us know if you're having any technical difficulties, and we are happy to reach out and help you with that. I will be putting instructions in the chat box on how to chat and how to connect to audio via phone if you'd like to do that. So please keep an eye on for that. And again, thanks so much for joining us. We're going to get started at 3:05. You're welcome to go ahead and introduce yourself in the chat box. Let us know where you're calling in from. We'd love to hear from you. Thank you. Hi everyone. Thanks so much for joining us today. We have a lot of folks who are joining the platform all at the same time, so we're going to go ahead and give folks a little extra time to get logged in and settled. So we're going to get started today at 3:05. If you could go ahead and use the chat box to introduce yourself, let us know where you're calling in from. Everyone has been muted upon entry, so please go ahead and use the chat if you have any questions or comments. And definitely please let us know if you're experiencing any technical difficulties. We'd be happy to reach out and help you. When you're chatting, please make sure the to line goes to all participants so that everyone can see your message. I'll be putting more detailed information about how to use the chat as well as how to the audio via phone if you'd like to do so. So thanks again so much for joining us, and thank you for introducing yourselves in the chat. We're going to get started in about 5 minutes. Thank you. Everyone, thanks so much for joining us today. We have a lot of folks who are joining the platform all at once, so we're going to give them extra time to get logged in and settled. So we're going to get started at 3:05 in about 3 minutes. Everyone has been muted upon entry, so if you have any questions or comments, please use the chat. And when you're chatting, make sure the to line is going to all participants so we can make sure everyone sees your message. I'll be putting instructions in the chat box on how to use the chat, as well as how to connect to audio via phone if you'd like to do so. And please continue to go ahead and introduce yourselves and let us know where you're calling in from. So thanks again so much for joining us, and we're going to get started in about 2 minutes at 3:05.
Welcome, everyone. This is Denise Solzbach. I am the director of the National Center at the Institute for Innovation and Implementation at the University of Maryland, Baltimore School of Social Work, and I'm the deputy director of the TA Network. Thank you for joining today's Managing Now for a Better Tomorrow conversation. We will be tweeting throughout this discussion. If you would like to join us, please use the hashtags BetterTomorrow and TA Network Talks. And please do tag us at Institute UMSSW. We do hope this conversation finds you safe and well today. We recognize this is a challenging time for all of us in children's services across the country, most especially for the families and the youth we serve. We have created these conversations for you to have peer-to-peer opportunities, for you to talk with presenters as well as one another. We encourage you to use the chat box to share your thoughts and resources, as well as questions for the presenters. We see you all doing a great job using that chat today. It's fantastic seeing all of you from across the country joining us. When you use the chat box, please be sure to select all participants. This will allow everyone to see what you are sharing. In follow-up to today's discussion, we will send everyone who registered a link to today's recording, as well as all of the resources and your insights that you shared in the chat box. So please keep it coming. This very much will be a conversation today. You will see the presenters joining us from their homes, and we will not use a PowerPoint during the discussion. And this series is truly about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. We truly do value your participation. If for any reason you lose us, please log back in. If you lose one of us or we go down for any reason, please know we have a brainstorming team ready and available and very good at bringing us back up. So please stick with us. As I mentioned, this is a conversation series. So far, we've had, I believe, 9 or 10 discussions, and we have recordings available for you on crisis communications. We had 2 of those, as well as in-home behavioral health. We had 2 discussions on supporting families. Similar to today's discussion, each of those discussions reached our maximum registration, so we had 2. We also had a discussion on residential interventions, mobile response and stabilization, school mental health. And last week's school mental health focused on supporting students and caregivers, their families. And we'll be holding a second school mental health discussion tomorrow on supporting educators. And we also held a prior conversation on housing and homelessness. And again, you can find all of the recordings and resources in our website, which I'll show you in one moment. In addition to school mental health supporting educators, which will take place tomorrow, on Friday, we're going to hold a discussion on rural mental health at 2 p.m. Eastern. And we're also working on additional conversations for you, including supporting tribal communities and one on supporting 4 young professionals working in children's services. To sign up for conversations and resources during COVID-19, please go to our website, theinstitute.umaryland.edu/COVID-19. You can also get updates through our weekly TA Telegram, and we can put how to describe in the chat box if you're not already subscribed with us. As you all know, today's conversation is on infant and early childhood mental health during COVID-19. We have a great panel of presenters and experts for you to engage with today. Kate Wasserman is with the Institute for the Innovation and Implementation at the University of Maryland School of Social Work. She's with our Parent, Infant, and Early Childhood team. She, together with Lauren Rabinowitz from the Georgetown University Center for Child and Human Development, they co-lead the TA Network's Early Childhood Learning Community, and Lauren will talk a little bit about that in a few minutes. We're also joined by Linda Calles. Dr. Calles is with the Department of Child and Family Studies at the University of Southern Florida, and Linda and her colleagues lead our cultural and linguistic competency work within the TA Network. Also joining us today and who will be moderating and facilitating today's discussion is Liz Manley. Liz Manley is also with the Institute for Innovation and Implementation. She is also working with several of you across the nation as she's the technical assistance lead consultant for several sites as part of the TA Network. And she also leads our clinical workforce development work. Finally, and certainly not least, Christopher Belanci is with us again today. Dr. Belanci is from the Judge Baker Children's Center at Harvard Medical School, and Dr. Belanci serves as the medical director for the TA Network. With that, I'm going to turn it over to Lauren, and thanks again for joining us.
Thank you so much, Denise, and thank you to everyone for joining us. So I'm just going to be very, very brief. We're all going to make some opening remarks, and then we are really looking forward to the conversation today and getting to all of your questions. So the early childhood learning community has been serving the early childhood system of care world for many, many years. About 2 years ago, we broadened the learning community to welcome members from any discipline, any grant program, any role. We have one criterion for joining, and that is to have an interest in supporting early childhood systems. So we have members from a range of local and federal grant programs across the country. We have folks including state policymakers, program administrators, mental health consultants, direct service providers, family members, and educators, just to name a few. Operating in the COVID-19 environment has impacted everyone, regardless of your role, funding structure, or geographic location. So today we welcome your questions and considerations from everyone. Our early childhood workforce is so varied and purposely cuts across the age span and service setting continuum. So we want to hear from everyone. I'm going to hand it over briefly to my partner Kate for a few other opening remarks.
Thanks, Lauren. Yeah, just a moment or two to give a little bit of perspective to the conversation, and then hear from our other panelists, and then most importantly, hear from all of you. But I think something that has grounded us in these conversations to date is really leaning into the field of infant mental health, which is intentionally varied, as Lauren said, in discipline and scope, and intentionally really anchored in supporting children and families where they already are in their communities. I know no other group of people more flexible than those that work with infants and parents, and just to really anchor that, only half of the work is with the young kids sort of playing on the floor, so to speak, and the other equally most important work is with their caregivers, including their caregivers within their homes, as well as within classrooms and other settings, and really thinking flexibly about how we support both the stability and stress levels and functioning of both of those ends of the dyad during our discussion today. Christopher Belancy is going to talk a little bit now about just some perspective on COVID in general, as we manage this long or short process.
Hi, and welcome to everyone. It's a pleasure to be here with you this afternoon for this conversation. I actually was just checking my calendar because in the Boston area, the world turned on its axis on Friday the 13th in March. And I literally had to go back and say, so how long have we been at this? Because we're going on 7 weeks as of Friday. And in an earlier conversation, I talked about how I think of this as kind of in chunks. So we're just finishing, I think, the beginning, and we're very much now, I think, in the middle of this crisis. The beginning was characterized by, oh my goodness, what in the world do we do now? How do we figure out how to adapt our practices in whatever child-serving profession we find ourselves in, to working remotely, or can we continue to do high contact, high engagement sorts of activities? If so, how do we do that safely? Do we have access to protective personal equipment for our workforce? And how do we figure out how to achieve the same global outcomes for children and families, but with perhaps different means of getting there? And what is that pathway? And for all of you working in the infant and early childhood behavioral health space, how do you begin to think about still supporting those families, either through remote means, or if you are still doing in-person contact, how are you doing that? And I'd love to see those kinds of responses pop up in the chat box. I'm presuming at this point, most people are working remotely and trying to figure out how to support children and families. So what are some of the obstacles to doing that? And then what ways have you overcome those obstacles in delivering those services and supports to these children and families? I'm going to now turn it over to Liz Manley to talk a little bit about kind of a systems perspective before we hear from Linda, who's going to talk a little bit about the particular disparities we're seeing emerge from the pandemic.
Thank you, Christopher. So I'm just going to take a minute to talk about how we take this, what is really an enormously overwhelming situation, and try to figure out how do we find the positives within the work and what's going to happen moving forward in preparation for what lies ahead. And with all crises comes opportunities, opportunities for growth, for new innovations, for time to be supportive to the people who are doing the work on the ground. But in order to do that, we really need to recognize where we're at and have a game plan for where it is that we plan to go. And so I just take a minute to just say, in all crises that enormity that we think about, certainly in my lifetime, things like 9/11 and Superstorm Sandy, because I sit in New Jersey, Katrina and the impact of Katrina in New Orleans. And the way to think about some of this work is, what are the really important lessons that we've learned about how do we, what has happened, how do we prepare? And I know that this is beyond the scope of anything that we've seen before and has presented some unique challenges. But one thing I want to say about these unique challenges is there are also opportunities. The shift to virtual technology is both a positive innovation that I was certainly advocating for in my time in New Jersey as the Assistant Commissioner at the Department of Children and Families, because we could see the benefit of being able to get to some youth and families in a way that was creative and thoughtful. And so I just want to say, be prepared, right? Be thinking about not just what's going on right now, but how do we get ahead of what's going on in the future? And one other real thought, since we're talking about the littles, as we like to call them in New Jersey, this is really an opportunity for bonding and time with families, but it's also time for us to think about what that's going to look like in the future. And so let's spend some time today really having a conversation, thinking about what's going on right now, and let's see if we can put our collective heads together to figure out how we're going to move on to the future. Now I'd like to just hand over to Linda with a quick question. I think it's probably not a quick question, but I think an important question for us to really be thinking about, and that is, what are some of the key issues related to health equity that we should be thinking about during COVID-19 as it relates to early childhood issues?
Great, thank you, Liz. Hi, everyone. Thank you for, I want to thank the panel for asking me to join in on this second conversation that I think is so important. And I think with regard to this question of health equity and disparities, as Christopher mentioned earlier, I think it's really important for us to start to center the question or the issue of structural racism and what that means in these conversations, because of the the far-reaching effects that it has on people's health and lives and well-being, right? And one of the things that I think is really important for my work, my research, and other researchers, and hopefully practitioners like you all, I'd really love to hear from everyone in terms of what they're seeing on the ground, has been these issues that we've seen come up more in the news, obviously, and we're working as researchers to get a handle on these around particular communities that are facing really just really life-threatening challenges at this point with regards to this COVID-19 issue happening that we're all experiencing. One of those has to do with, we heard early on people that look East Asian being targeted because they are seen as people that are causing or have caused this crisis, which is problematic. And we know there were attacks that involved children as well in some parts of the country. So that's really concerning and are things that we need to keep looking out for as providers and those of us that interact with families on a regular basis, to listen to folks when they come to us with these issues and believe them, right, and listen to them. The other that we're seeing are this discussion around disparities, and we're seeing reports with African Americans in particular, but also with Latinos and in Indigenous Native American communities, where we have really disparate prevalence rates, where people are getting infected at higher rates. And the discussion around these infection rates it's important to to consider that there are a lot of factors that go into these higher rates that have nothing really to do with biology and have more to do with social factors. And for African Americans in particular, one of the things that has been very concerning to see for researchers like myself has been instances where people have gone seeking medical treatment, medical help, and have been turned away repeatedly, resulting in, unfortunately, deaths, right, of people that could have been prevented, and where there were, decisions that were undertaken that seem to have placed blame on those folks, or placed undue suspicion about drug-seeking behaviors and other things of that sort. And then really kind of as a researcher, I'm always interested in the data. I think with Indigenous peoples in particular, the Dene Nation, also known as Navajo in this country, where there's such a big disproportionate infection rate, and folks, we're not even seeing that in the data, which is really challenging for those of us then that are working to address the needs of communities. So I think when we talk about these issues, it's really important to consider that this crisis is helping us to uncover or to see more clearly these issues of racism and discrimination, which have been unfortunately part of our country's fabric since its inception, in ways that are more clear and really help us to center that discussion, which is important for us not to lose sight of. So I guess I'd like to pass it back to the panel and to folks so that we can start the discussion off. Thanks.
Thank you, Linda. Before we start the discussion, I just want to make sure everybody goes to all participants and not all attendees, so everyone can see your questions in the chat. And we have some good information that's already moving in the chat. So let me just start by asking the first question, or talking to the panel, thrown out to the panel, the question of how do we take care of the little guys in terms of helping them understand masks and what masks mean and why they have to wear one, why other people are wearing them in the community. And I imagine that there's a couple different ideas. So just going to throw it back to the panel, maybe starting with Lauren, since she started us off today.
Sure. Yeah. I think that's it's a great question. It's one as a parent of a 3-year-old, I have been thinking about myself how we're going to introduce this. So yeah, definitely there are considerations at different ages. For kind of toddler, early childhood ages, song is a really great way. I think we use songs in lots of different ways for young kids. So there's actually a couple of different artists so far that have come up with some songs about why you put your mask on. In addition to those more independent folks, Daniel Tiger, I believe, Sesame Street. There's a couple of more mainstream media companies that are already addressing this and have put out some great resources. I actually saw someone in the chat put a great idea, which is to have young kids hold a mask and actually, put it on a teddy bear, put it on their own face to see what it's all about. So those are just a couple quick ideas. We can get you some links. They're probably already circulating in the chat, but we'll be sure to follow up with where you can find some of those resources to watch with your kids. And then I think that just the other piece that I would say is having the conversation, calling it out. We always talk about this with young children, is to normalize something that might seem a little bit different. I think you could think about it the way you might with any other sort of medical type of condition, when we're trying to talk about young children, about those that might have a disability or use some sort of, that might be like an apparatus that's in use. It's exposure and talking about it.
Thank you, Lauren. I think that it's really difficult to have a conversation about masks without also talking about some of the challenges within the disproportionality discussion. And I'm wondering if Linda, if you had some thoughts about how we might approach, or maybe have some solutions in the community about how to address some of the challenges that young men are having around wearing a mask in the community as they're supposed to, and yet having some real misunderstanding about what that's about.
Yeah, Liz, I actually don't have solutions per se. I think that we are working to find those. We have, just to sort of give a little bit more context, there have been reports also of young men, African American men in particular, wearing masks and being, questioned by police or followed by police or asked to leave stores. And this is yet another example of where these sorts of things occur, and have occurred outside of this, the context of this crisis. But I think that working together, we have, in our work with communities, looking at ways to connect possibly with, police jurisdictions and other folks in the criminal justice area to really try to bridge some of those gaps and try to at least get folks on the same page. But we're seeing a lot of to be honest, and a lot of concerning reports around the country around police also pulling people off of buses that aren't wearing masks, and then possibly also, you know, high rates of infection within the police forces that are doing this. So that also raises some key questions, I think, that are difficult to really provide good recommendations for, but some of these community efforts to really bridge some of those gaps and bring key partners together, I think would be a good way to start.
So it seems like this is an opportunity that we want to really begin to think about how do we address some of the challenges and providing really good support and education to the people who are surely struggling around these issues. So I think that is one of the areas that we want to be attentive to. We have a lot of other questions in the chat. I'm going to shift gears just for a second and ask the panelists around children's sleep disturbance, which we know there's probably a lot of that. You know, there's a lot of adults who are having some really interesting dreams these days, is what I hear, but also wondering if there's some solutions on how to help children and families, you know, as children are struggling on the sleeps.
Liz, I'd be happy to talk to that a little bit or give the initial response. So I think the most dangerous question to ask a parent ever is, are they sleeping through the night yet, right? Because it implies that once a baby does, then you're fine. You can, you know, watch Netflix and attend to whatever you need to for the rest of your foreseeable evenings. So I think part of it is to understand that when children have sleep regressions, it's one of their ways to communicate that they're having a regulation, you know, disturbance. So really any regression, be it sleep, toileting, eating, any of the sort of regulatory systems in the body are often how kids who can't communicate, even if they're very verbal 4 or 5-year-olds, just the disorganization that they might be feeling. So I think the number one advice would be to expect it, right? To not get so thrown off by it, to meet it with kindness and regulation in yourself, because it's hard to calm a child when you're not calm yourself, and to try to, you know, be proactive on the front end to keep schedules as consistent as possible, especially around naps and nighttime, so that kids aren't sort of losing the structure of their days so much.
Thank you, Kate. Did anyone want to add any additional information for folks around sleep?
I would just echo what Kate was saying about the importance for us to model what we want our children to understand about this crisis and the pandemic. You know, young people, particularly the youngest, look to us to know when to be afraid, when to be scared, or how to interpret all of this new information. And so it's, in a way, up to us to spin that in a developmentally appropriate and accessible way for the littles. And I think that means making sure that we're taking good care of ourselves. Self-care is not selfish. It's actually essential. And it's essential not just for you, but for your child. And so how do we ensure that we're conveying that message to the caregivers who are in unprecedented times having to manage both their work lives and their child caring responsibilities with often very little support? And owning that is an unprecedented expectation, and that we're likely to have times when we don't do it as well as we wish. But as much as possible, trying to stick to some kind of a schedule. I know for me, I try to start each day like I would typically on a Monday to Friday when I would be going to the office. I try to shower, I try to shave, I try to dress, I come down, I fix breakfast, and I go to wherever I'm going to be working in my home that day, and kind of try to stick to a norm. And similarly, at the end of the day, I decide that I'm going to go and change out of my work clothes and get into more relaxed clothes and mark that a day has passed. Because one of the things I'm hearing is, you know, it just seems like Groundhog Day and it's just another day. And if we're not marking the passage of time, I worry we're really going to burn out. You know, in Massachusetts, we've now canceled school for the rest of the academic year. So for the little ones that were actually accessing school, or for the really littles where they would be in some kind of early childhood supported environment, how do we instill some fresh sense of how we're going to get through this, because again, we've kind of moved out of the crisis first stage of this, but now we've got that long period ahead of us of trying to figure out, all right, this is becoming the new normal with no particular end in sight, depending on where you are in the country and what your political leaders are deciding about social distancing and listening up on those rules. But we're still going to then have to figure out, well, what is the new normal going to look like? And can we start opening and reopening our centers? And what would that look like? And there was a question about, split schedules and how are we going to adapt to a continued need to try to protect each other and those we're serving, given some continuing need to do some social distancing. And that's going to be a challenge with each of the child serving sectors.
And I'll just quickly chime in just for something, just one concrete idea of everything that Chris and Kate said is excellent and right on. And both we're talking about the importance of routine. So when we think about sleep hygiene, we know that is not something that begins at 7:45 if you have an 8 p.m. bedtime. When we think about sleep hygiene, we want to think about our entire day. And we want to think about how we're getting up in the morning and what we're eating throughout the day, and are we moving our bodies? So all of that. And then just for those that have younger kids that are trying to figure out what bedtime even looks like right now, there's lots of different very concrete strategies out there. We'd be happy to send you some links, things like bedtime schedules, picture schedules to really get kids involved. There's been some funny things going around the internet that I think is actually very true, where a lot of us are sort of in our day pajamas and then switching to our night pajamas. But just to think carefully about how you are transitioning from the end of the day into evening time, and getting kids involved with that transition and giving them some sense of control in whether they are first, going to brush their teeth and then read a story and little things like that. So we can definitely send some additional resources about those kind of bedtime routines.
Thank you. Since we're thinking forward too, right? Planning for now, really thinking for the future. One of the concerns that came up from Melissa Williamson was a concern about how to reopening. If class sizes need to be limited, we would likely have to stagger times and start times for youth, for children. How do you determine how to accommodate families' full-day childcare needs? Any thoughts about that? Okay, we're still going to be working on that one, I see. No problem. Another question that keeps coming up is a lot of questions around technology. What technology is best to use in engaging families, and how do we address the challenges for families that don't have access either to the technology itself or to Wi-Fi? Any thoughts from folks?
So I wanted to just chime in. I work with folks involved in child welfare systems in Florida, and this has been an ongoing issue as the system works and providers work to connect with families. And I think I noticed someone in the chat mentioned that in New York, the cable company is making Wi-Fi or internet available to families with children, school-age children, and that's happening across the country. There are various programs of that sort. But again, sometimes what we're finding is that families may live in homes that aren't set up for good internet connection, or just even with the cable system, and having issues. And so reaching out to families and asking them about using their phone, using WhatsApp and FaceTime has also worked. And the challenge there might be to try to figure out whether guidelines and rules allow for using phones for that sort of provision of service and care, but that's one way to kind of work with families. In the projects that I'm working on, there's one that is focused on providing services with peer specialists to families that have children that have been removed from the home, which which is also, especially for parents of very young children, has been very difficult. But trying to work out ways where they can see, virtually their children and connect with them, and in these ways when the internet isn't an option, has been something that we are looking into and continuously trying to connect with families on.
Yeah, something that we've worked on or heard about through our rural system of care grants in Southern Maryland that I saw just pop up on the chat as well is school districts in rural areas using school buses to drive out with hotspots to different areas that are just disconnected, which I just thought was such an innovative idea. And I think the other thing too is to really to try as much as you can to survey your target families and not just assume that it's just web-based, but what are their preferred ways of either texting or different sort of video chat options where you can not have to access it during a certain time, but access it later when you can, because maybe the family does have Wi-Fi, but has one computer. And so, can't join the, 11 a.m., kindergarten chat, but, can attend in other ways.
Thank you. I think the challenges around connection are ones that we're really going to need to continue to address individually as well. But I love that bus idea. That's really just so smart on how to get Wi-Fi into some of the more rural communities. We do have another question. How do we address these concerns, the concerns of populations, individuals who are not taking COVID seriously at all? And do you have any thoughts about engaging in conversations that might be of importance with families and with partners in the work?
I can just start briefly. Oh, sorry.
No, go ahead.
Well, I was going to say is that I think this just goes back to this idea of modeling, right? So there is we can only get so far in conversations with, using data and facts. And of course, we always want all of the information we share to be evidence informed. But I think our own individual modeling, we know that young children are very susceptible to what they see at home, what they see in their neighborhoods, what they see from community leaders. So as adults, I think modeling is the number one way we can try and influence behavior.
Yeah, and I do think different people listen with different parts of their brain to different kinds of information. So some people will be riveted to the news, maybe to a default, and they want facts. And so for some people, I do think that argument about showing curves and showing how different communities are being impacted differentially, both in terms of numbers of infections and deaths, they're going to be more responsive to that. Others are going to be more responsive to how you're not taking care of yourself impacts the larger community and the notion of some social responsibility. So we made the decision to have my 83-year-old mother come and live with us. I think we're going on 6 weeks. She's downstairs somewhere. And, for me, other people not attending to social distancing guidelines or wearing a mask or thinking about ways that they're going to protect themselves has a direct impact, because when I have to go to the grocery store and may come in contact with those folks, even as much social distancing as I can do, I may be bringing the virus home because I was exposed to it by other people who are not washing their hands and taking the appropriate protective measures. So, while I wouldn't necessarily confront somebody who's doing that, I do think that if I had a relationship like you do with the families you're working with, I would want to bring that up in some way, because, this is an unprecedented situation where we all have to be thinking about the betterment of our society, our community, our family, And it goes beyond just decisions that we're making for ourselves because it impacts others. And so I think there's at least two different ways of trying to convey that for people who are looking to minimize. And my guess is that, part of the reason they may be looking to minimize is that they're overwhelmed, and so also having some empathy for that position, but not letting it lie there and really trying to use education, outreach, personal engagement, relationship to try to move them to think differently and then behave differently.
Thank you.
If I could just add to that really quickly, as Chris was talking, it made me think about the FAN approach, or facilitated attuned interactions, out of Erickson Institute, which many infant mental health folks will know. But that the idea of really, trying to understand what their concern is or what their barrier is, so that you're able to give a more informed response, because it is going to be very varied based on what the barriers are for them or points of resistance are for them. Happy to share more information about that model as well.
Thank you. So from Ruth Paris to all participants, we have the question of how are people supporting families where there is a history of child maltreatment or substance misuse, and how are people able to put eyes on young children and assess stress levels in parents? So, well, let me just make one particular comment and saying, how do we not over tax child welfare for children that, how do we be appropriately worried and concerned about abuse and neglect, and at the same time, not over-report for families that just maybe not have access to technology, or there might be other challenges, and what other partners can we use in this discussion to help us make sure that children are safe and that parents have what they need. So any thoughts about that? Christopher?
My agency actually has a contract to staff our child at risk hotline for the Commonwealth of Massachusetts after hours. And we've seen a significant decline in reports to our child welfare hotline, as most jurisdictions have. I've heard reports as high as 50%. In part because all of you good people who would normally be working very closely with these families have less contact face-to-face, as do school teachers, as do primary care providers and pediatricians. And so it's to be expected that the reporting would go down with less contact with the little children. At the same time, given the stress that so many families are under, it's every reason to believe that perhaps more child abuse and neglect is occurring. And so I think it's critically important, as you're engaging these families, to have a high level of concern while not being overly reactive. And I think that is a fine line and a balancing act. But I do think that in the best interest of children and protecting them from harm, from their caregivers or anyone else that they're coming in contact with, as families have to make critical and tough decisions about how to manage childcare responsibilities while also trying to keep their jobs, and if they're not able to work remotely, as many essential workers are, trying to figure this out as childcare centers are closed. And so we're putting families in unprecedentedly challenging circumstances. And so having empathy for that, but also having a level of vigilance about situations where kids may come to harm, and not hesitating if we've got a suspicion or a concern, recognizing that I think most of this workforce would be mandated reporters, and there is a need to follow up and report that, in the hopes of hopefully generating services and supports for those families, not necessarily blaming them for their circumstances, but hopefully bringing the service sector's attention to these needs. And, it's going to be a critical time for advocacy. There's lots of big checks being written by the federal government, but where those dollars go is up to us to ensure that it's going to the families in most need.
Thank you. I see another question that, Christopher, you might be able to. How about special needs? Are there suggestions about how to be supportive of families with a child with special needs?
you were breaking up there a little bit, Liz, but I think you're asking about children with special needs and how specifically to support those children. You know, I think children with special needs are going to be the most challenging for families to support in home. I think many of them have higher needs for sensory engagement, higher needs for activity. So thinking about safe ways to channel those outlets. If you are in a community where children can be outside for some part of the day, doing that in a structured way while ensuring they're not coming into contact with others in any kind of inappropriate way. Trying to figure out how to engage their learning and their serve and return needs through whatever manipulatives you're able to generate in the home. I think being incredibly creative. If you've got the opportunities to take turns and do split schedules of child rearing, I think that's also going to have a high degree of sustainability for parents, including whether it's multi-generational supports or primary caregivers who can figure out how to flex their schedules. So some people are at work if they're working remotely and doing childcare in alternative ways. And then again, just reminding people, try to find some ways to take some time for yourselves, figure out how to do a date night, whether it be virtually or hopefully together after the kids go to bed, trying to hold to some sense of schedules and rituals so that you can sustain yourselves through this long period that we're facing.
Liz, can I add a little bit to that as well? So in our state, in Maryland, we do some coaching for the early intervention providers, and they've just been initially re-engaging families through tele opportunities, but a couple of them talked about families proactively reaching out aside from the just 1 hour or 45 minutes of speech that they get with some questions, and how meaningful that was to the workforce to get to sort of serve and support that family in an additional way. So I would really encourage any of you that are working with families with kids with special needs to really think about you know, how you can encourage them to reach out to their service providers proactively or in addition, and it's not an extra burden at this time. So whether it's special ed or IEP needs or IFSP needs, other sort of peer navigation supports, encourage them to ask for some more support right now, because the workforce is happy to provide it when they can. And then to both that and the question before that, I think also really thinking when we're worried about families, a lot of times infant mental health folks will have conversations ourselves about the well-being of the adults, but really try to proactively pull in some adult services and supports within your system, so that it's not just at our feet to address all of the needs of the adults when there's concerns about you know, abuse or stress or substance use or any of the above.
Yeah, and I think one piece I would just add to all of this in thinking about safety and in thinking about school systems. So this gets both to reports of child maltreatment. You know, we know that those reports are down. We do not believe the incidence is actually down. And also, I think the same ideas would support some of these other questions coming in about supporting family members and supporting children that have all sorts of differing needs. And so so the point I want to make is about actually individual school, not even a school system, but schools themselves having very concrete plans of action. So I believe many school districts are issuing, there's guidance out there, but even down to the actual school building. So who is having the first contact with a particular situation? What if a student is submitting an assignment and a teacher is really concerned about something that they receive? What is that teacher's response? Are they supposed to call the police? Do they call the principal? Are they getting the guidance department involved? There's even at that very granular level, there's a lot of variety in how schools are responding. And of course, schools did not have time to put grand plans into place. And so it's been a lot of responding to cases as they're happening. So we certainly would encourage schools to be making really concrete plans, sharing them with their staff and also with families, so everyone knows what the plan is.
Thank you. 2 comments from the chat box I just want to highlight. One is more frequent, shorter communication with both youth and families is a really good way of thinking about it. And Christopher said, do your pandemic best, and that's really what we're trying to do on a daily basis. Thank you. Okay, for the panel, states are treating family visits for children in care differently. Some states have completely suspended in-person visits, while others still have them. I'm concerned about all children who are not able to visit with their parents because they are in temporary guardianship of their respective departments. I'm mostly concerned about infants who need that contact with their parents to establish bonds. What's your opinion, and what are states doing regarding in-person visits? Any feedback for Daly Johnson on this one? Thoughts about visits with children who are in care? Christopher, do you have some thoughts on that?
Sure. We're talking about children in foster care or children in institutional settings. With the little ones, I'm assuming we're not talking about residential settings. So foster care.
Yeah.
Foster care, yeah.
Yeah.
Yeah, and I think the question was raised, or there was a point raised earlier in the chat about some foster parents being uncomfortable giving their phones out to birth parents to help facilitate those connections. I've actually heard the opposite, that for some foster families who had an expectation that they would facilitate in-person visits, even before the pandemic, they were somewhat uncomfortable with those person-to-person, parent-to-parent contacts, and are now finding actually it's easier to engage birth parents through the various technologies. If they're uncomfortable actually physically giving their phone number out, they can certainly initiate the call and use call blocking technology, which I think is included usually in most cell phone packages. And particularly if you're able to set up a set time, because some people are less inclined to pick up a call if it's call blocked and the return number isn't obvious, and we get so many spam calls. That seems reasonable that people would be a little protective of their contact. I think, you know, there are lots of technologies now embedded in smartphones, which most families do have. I understand that that may be less available, or cell signals may be less strong in some rural areas. But, you know, FaceTime or Skype or even internet-based connections like WhatsApp and Messenger are some ways to be able to try to maintain that connection. You know, for the child welfare workforce, they've also had to go remote. And so most of the monthly visits between the child welfare worker and their children on their caseloads are happening virtually now as well. That's not true across the country, but that's true in many jurisdictions. Again, out of an abundance of caution to try to make sure that we're quelling the spread of this virus. You know, I think the most important thing is to try to maintain some sense of these parents in the child's life. And so sending photos, sending cards, writing letters, sharing drawings. If they do have technology, you can actually do a shared drawing through the Zoom platform. I think there's other ways of trying to remain engaged as best as possible and to ensure that those connections stay strong.
Thank you. So we have another question from the chat. Does anyone have any answers as to how to support children, teachers, and families with reentry into child development centers? I imagine there will be a lot of anxiety coming back in.
This is Lauren. I can start quickly with that. I was really happy to see in the chat that someone was sharing some resources that their mental health consultant is considering using. So I'll just put in a little plug for trying to, making the most if you are in a childcare center that has access to an infant and early childhood mental health consultant. So whether you have access to an individual like that or someone else who, can kind of stand in that role. A big part of what's going to help with this time and with reentry is lots and lots of education for providers about expectations, keeping expectations as reasonable as possible. The person who put in this comment said it perfectly. In many places, for the length of time that kids are going to be out of care, it's going to really feel like a reset. Starting over for some kids, we've been hearing lots of concerns about parents and caregivers who have children that were maybe even already having some school anxiety or separation issues before any of this started. And so what is it going to be like coming back? So without going on a really long tangent of all the different ways this is going to play out, I would strongly encourage childcare centers to think about what access and relationships they have to different mental health supporters that can provide as much education as possible and as many opportunities to sort of process before it happens, as it's happening, and throughout, because there is no way we would all be remiss to think that it's going to be an easy transition back. It simply won't be, so we need to be prepared.
Yeah, and I would add, so to Lauren's point about sort of it being a restart, I mean, often when you're introducing young kids to school as much as possible, there'll be sort of, it'll be like a short 2 days and then sort of a phase in process. And I've already, through some of the mental health consultants in our state, heard some people sort of thinking about that, which also seems like it might be COVID wise as well. and again, trying to coordinate that with parent work schedules and other siblings is not simple. But I would also just remind people that one of the, I guess, most beautiful and complex things about early childhood is that, we're often detectives trying to understand what their responses mean. And so some kids are going to give a really linear response. They're going to be defiant at drop off, right? And it's going to be really easy for caregivers to say, okay, they don't want me to leave. This is scary for them, and to be able to talk through it. Some kids 4 days later are going to, have some fit at home. It doesn't seem at all related to school. And so just meeting it with kindness and trying to understand what the sort of quote unquote challenging behavior might be expressing, because it's always expressing a need. And it might be easy for us to determine as adults, and it might not.
While we're talking about that, any resources for keeping children engaged during telehealth, using telehealth technology?
This came up on our last conversation as well, and it's not the same for young kids. The Zoom. I think I shared as well. My 3-year-old said, "FaceTime with friends is weird, Mom," right? Because they're sort of just emerging from that zone of parallel play into engaging with peers in person, and it can be a little bit overwhelming for them. And again, they show dysregulation in a range of ways. Sometimes it's to be defiant or to not engage. And so some of the therapists were talking about that last time, and it really becomes a coaching conversation then to the parent, right? We need to allow kids to have the response that they're going to have, and not say in the moment you need to sit here for the 45-minute hour that you would have had in a different setting, and just know that their response is giving us information, and the best thing to do at that point is to stick with the caregiver, talk about what is this like for you to have that just happen. How are you reading your body cues? How would you respond if I wasn't here? What would be helpful? Is this typically how he or she shows distress or not? Like, how, really gauging how well they are, how easy it is for the caregiver to gauge in the child, whether it's when they're escalating from 0 to 60, and some strategies for that.
Yeah, I would just add there, lots of folks in the chat were sharing some fantastic resources. There are Facebook groups around this. I think this is a good time to be over prepared. As Kate said it perfectly, that those in the early childhood world are always ready for the unexpected, and are always very nimble in actions. And child therapists and those in this world, we always have lots and lots and lots of of tools in our tool bag, and this is certainly a time to have as many as possible. So I, strategies like if something doesn't seem to be working, shift gears, try a different game, have 3 or 4 lined up, or even more, and see how it's going. And I just really want to echo what Kate was saying. So I think it is just such an important point that whatever that child is showing, it is really important information. And so as frustrating as it may be as a provider or someone that's trying to help a visit be successful, to do some self-regulation techniques, and really be wondering, my goodness, this is an abnormal reaction from this kiddo here. What is going on behind there? And use it as an opportunity for information, and to know that if the visit or the session, whatever it may be, isn't going as planned, that's okay. There will be another opportunity, and we are, it's a learning experience.
Thank you. From Brittany Groom, she asked a question about children with significant behavioral health challenges and parents struggling. Do you have any thoughts about ideas about how to help those parents be able to work with their children and maybe even seek out or connect to behavioral health services?
So in my communication with some behavioral health providers, I think initially they were trying to figure out tele-mental health for their existing caseloads, and are now beginning to emerge to doing intakes for new clients. This is certainly in the world of infant mental health and early childhood mental health, which is so behaviorally focused, and you spend a lot of time as a therapist on the ground with kids, painting and doing puzzles and coaching parents. So we are a bit behind our other mental health colleagues in really engaging in telemental health. So I think that's been a bit of a stretch, but I think I'm hearing from different teams that thanks to the technology of today's existence, that's happening more and more, and that states are being forgivable about not needing physical signatures for consent for treatment and things like that. So certainly linking families to mental health, if they weren't previously engaged, seems more possible now than it did a week or 2 ago even. To Christopher's point about this moving from the initial crisis response to more of a stabilizing and containing space. And then we've, I think really the other point about trying to have more frequent and brief interventions with these families, I think is a really, really important one. So they may not be able to have a 45-minute chat with you because that leaves the child in the room by themselves or whatever it might be. But having some more standing check-ins that might be 15, 20 minutes at a time to just say how it's going is very good. Also trying to really structure, because parents tend to be, even on good days, poor trackers of behavior. It's either all good or all bad. So trying to track what is the hardest or easiest time of day for you guys, and how do we kind of learn from that? Again, a lot of the work of early childhood is how do we know based on the child's behavior, because they can't always articulate for us what's working or what might not be. How do we decode that and then place whatever's working throughout the rest of your days? And my last idea here, because I think it's a really, really important question, is support groups for parents. I'm seeing a lot of those, places that previously would see a kid and a mom, kid and a dad in sort of separate rooms, thinking about how to use FaceTime or Facebook rather, or other online platforms to have support groups. And parents are not worried about the privacy. They want to be able to connect with peer parents. So that's what I got.
It's my understanding early intervention is still up and running, correct? Am I right about that? Yeah, I think somebody in the box, in the chat box, was talking about that. Also have to remind folks about that as well, that there are interventions that are still available and open. A lot of mental health organizations have shifted to virtual platforms and are available, and a little plug-in for mobile response and stabilization still up and running in most states, and even face-to-faces are happening in the most extremes of concerning behaviors for children, with folks actually using personal protection to go in. So that's all happening. While we're at it, I do have a question for, I think Linda might be the best person to answer this. Someone in the chat actually reported that they've heard rumors that certain groups, particularly African Americans, who have told, who are reporting that their families do not believe that they can get COVID-19 and that they don't trust information from the CDC. Is that something that we've heard, or is there any thoughts about how to address, you know, some of the misperceptions within communities about COVID-19?
Well, I think definitely at the beginning stages of the COVID crisis, we did hear about this where, and I think a lot of the sort of discussion online was almost joking in terms of like, this is not going to affect us for one reason or another. And then became kind of an issue that sort of dovetails with this increasing rate of infection in the community. So I think definitely it's important to raise awareness and to kind of support the public health response of, like, you know, physical distancing and really trying to model behaviors that we would like our families to you know, take on as well. And to I think people are realizing though that especially in communities like Detroit, you know, New York City and other parts of the country where you have these really high rates of infection among African Americans, that this is not bearing out in any way, shape, or form. So I think we have to really try to get the word out that these are not that this is a rumor, this is nothing that is real, and that no one has that we know of has real at this point. We don't know that people have natural you know, protection or immunity from this, even people that have been, you know, infected prior. So really, I think just kind of making sure that we're all putting the word out about what we know to date, what's been confirmed by the CDC and other, you know, entities, researchers at universities that are putting out good information.
Thank you. I'm wondering how can we support, the question from the chat is, how can I support mental health of families of, who are in a shelter when the parents are using substances? Any thoughts?
So I mean, just you know, we haven't really spent much time talking about the substance use community and sort of what is happening there. You know, when we think about 12-step programs and the incredible importance of in-person contact. So, you know, if someone is in a situation where they have access to any kind of course, technology is another barrier here, but would just, you know, make sure that folks know that lots of those mutual support type of programs are using Zoom. So they're, you know, it is an option for some. And it is certainly something that should be suggested and encouraged, for, you know, for those that are that have access to technology that could possibly participate in a meeting. So that goes both for, you know, someone that might be actively using a substance, and then there's also programs for supporting families that are in that kind of situation.
You had a good suggestion in the box and the chat box around having diverse providers getting information out into the communities can be really helpful, and also using places of worship to share accurate and updated information can be incredibly helpful. I think those are really good places to start. Do we have any other thoughts about how we might be able to get some of that information out to the communities?
I think that's an excellent suggestion. Also connecting with just other organizations and communities, ethnic specific organizations, or just places where people are receiving support. There are mutual aid networks that have popped up throughout the country that people are connecting with to get access to food if they don't have it, or other basic needs. And this may be one way to, you know, to be able to reach out to families that that need it.
Thank you. We have a feedback in the chat from Keisha Hawkins, who says more factual information about numbers, rates of infection, put it on social media sites used by teens and young people in the African American communities. Seems like a very good suggestion to get the right information out into the right hands at the right time, for sure. Thank you, Keisha. All right. Any other, chat's slowing down, I think. Do we have other questions from the chat? If we don't, then what I'd like to do is, we do. Thomas Meyer says, we do not get the best information from the media, separating out our politics from facts when talking to our kids and grandkids. What are the most consistently reliable, updated resources to refer parents to? Great comment and question there, Thomas. So,
one of the things that we can share so the entire recording of this and what captures in the chat, as well as some resources, will be sent out. And one of the resources that we could send is a town hall that Sesame placed it with CNN, talking to kids specifically, which just warmed my heart, because how would that not? And actually, it made me think of when I was a kid, and some journalists doing a town hall on, at that point, the Gulf War, and they were like talking to kids directly, and it made me want to be a journalist, which I did not become, but it's, I think, again, a really sort of, developmentally appropriate facts that really are talking directly to kids about what's going on with trusted Muppets and folks. So we can share that.
Thank you. Christopher, did you want to share? Because I think you just put it in the chat, but maybe you could talk about that as well.
Yeah, I'm, a bit of a news junkie, and also being a physician, my go-to source has been Stat News, which I find to be very reliable, well-resourced, and I often find is being repeated in some of the other news outlets. They've been following the whole remdesivir as a potential treatment agent, and some positive news coming out of an NIH clinical study. So, we may soon have an antiviral that can at least be effective in minimizing lengths of hospital stays, and maybe keeping kids or families or older folks mostly off of ventilators and out of ICUs. And that's information that I got through Stat News. The Surgeon General of the United States is an African-American man, so that's another potential resource. There was a really good resource that we came up with around addressing the issue of structural racism, and maybe Michelle can put that in the chat box, as a way of both acknowledging for some of the groups that have historically been marginalized in healthcare access, being able to see a sympathetic portrayal, but also recognizing that this is a pandemic that not only does it not have any, doesn't choose its victims. In fact, people of color are at higher rates of both infection and death in some of the largest cities. So in Louisiana, in New Orleans, in New York, in Chicago, and Detroit. And so being able to make sure that that is being reliably transmitted. I think Dr. Fauci is an American hero, and I trust anything that man says. And he's a real truth teller, and he does it in a way that allows people to hear it and not be overwhelmed by it, but be able to incorporate that information. So I think again, it depends on what your usual sources of information are. But I think there is a lot of misinformation about this particular virus and pandemic. And so I think it's really important that people think about the sources of their information and look to try to find as reliable a source as possible. The Children's Bureau has been putting out some very good information. Michelle put in a link to a SAMHSA resource that's putting out reliable information. So I do think some of the governmental entities, including some of the state governments, are providing some reliable information, including contextualized information specific to their communities, which may again go to address some of the denial that can be occurring in some places.
Thank you. Linda, we have a question in this box that I think you might be helpful with. Rosa Alvarado is asking, how do we help immigrant communities at this time?
Yeah, I think I saw that question. I think one of the first things is to look and make available whenever possible resources in other languages, on languages other than English. And I think, that Michelle can send out some of the resources that my team has worked on pulling together. The CDC has resources. There are a lot of resources in Spanish, and local organizations that have, started to either translate or make some of these available. In general, I think trying to address some of these questions of stigma and fear about either, misinformation or not having enough information, and trying to connect. There are, in most areas of the country that have high rates of immigrant populations have immigrant organizations that serve the population directly that may not be health related, but which we can partner with to get news to them about our services, what we're doing, how we're trying to reach families in new ways in this new time, and also to help these organizations help us to reach the communities in better ways.
Thank you. So from Ellen Harms, we have the question, any advice for people who might be working within systems where leadership's response to telework has been to create a lot of busy work and documentation demands for their staff? It seems like some employers are responding to this new reality by micromanaging staff in order to prove that people are actually working. This seems like a recipe for burnout for people on the front lines who are trying to work with children and families. So I'm just going to make one quick comment and then throw it to the panel, and that is, I think it's really important at this time for us to understand what's working and what's not working, and want to make sure that the busy work isn't actually busy work, but is really something that's going to help us figure out whether or not children and families are getting what they need, and whether or not those resources that we're putting into place are helpful to them. Are they working? Does telehealth, is it working for all youth? Is it working for some youth? Are there ways for us to figure that out? So I want to put that to the side and say that's really important work and not busy work. But the idea of busy work means like we're probably going to need to have some conversations with leadership about the challenges that you're experiencing in this time of just trying to get through the day of trying to help children and families. Any thoughts from any members of the panel on this one?
Yeah, I'll initiate. So I think in any field, if it's early intervention or mental health or consultation, education, that there should be some elements of reflective practice, reflective supervision rather, going on. And so I think being able to use those conversations with your supervisor to have non-confrontational, but open conversations about what you're juggling at home and the burden of what an hour of engaging a family really looks like for you, and having a problem-solving conversation around the stress that you're feeling.
Yeah, I think that's great advice, Kate. And then I think what also just comes to mind for me is sort of what I was saying before and thinking about school systems. That there's no blueprint for any of this right now, and I really appreciate Liz's comment of thinking about what's working and what's not working. And again, maybe and I certainly can't know the particulars of the situation that this one person is experiencing, but again, let's put on our detective hat and wonder, to who in these larger systems, and lots of us are sitting in very large systems with many levels of authority, and so just wondering who's asking for what types of information, and maybe having sort of an internal brainstorming session, and then exactly as Kate said, seeing what hopefully there is some kind of support system, a supervisor, someone to have a really constructive conversation with, to sort of say, I imagine this information is being used for this purpose, and here's why getting that level of information is impacting my ability to respond to this parent, or something like that, just to try and again take a deep breath and think, why is this happening? Someone asked for this information somewhere, and why, and maybe there is something that you don't know about, that someone does need something, and so hopefully there would be an opportunity for that kind of action-oriented conversation.
As a tag on, another question from the box from Renee Stewart was, how is the workplace supporting workers who are frontliners who've experienced loss, perhaps due to COVID-19, who are triggered and finding it difficult to manage this experience?
I think we need to be thinking about this as a grief experience, and whether or not we've lost someone to COVID-19 in our circle of family and friends, or in our community or neighborhood. We're all grieving a loss of all that was normal and valuable to us. Human connection. Connection to our coworkers in a direct way rather than through these screens. Connection to our places of worship if we're not able to go there, or they're not streaming virtually. Connection to our sense of place, our sense of normalcy. And so, I think I'd start from a position of validating that grief experience and naming it, because I think one of the things that causes a lot of anxiety and feeling unmoored is trying to process, what is this experience I'm having? Because it's unprecedented. Nobody I know of has been through a pandemic before, right? I mean, the last one was 1918. So theoretically, there could be some 100-year-olds on the call, but and more power to them if they are. They figured out how to manage this technology. But, the vast majority, this is a novel experience. And so I think there needs to be a lot of forgiveness, a lot of self-care, a lot of creativity, which is hard to do when you're exhausted. And for the frontline workers, they're in an incredibly tough spot. My niece is a speech and language therapist and working in a facility outside of Boston. They've become the step down for elderly patients diagnosed with COVID-19. So in many ways, she's overseeing their deaths. And her boyfriend, who she doesn't live with, isn't allowed to visit with her because he has roommates who have said, if you go and spend time with her, you can't live here because of fear of contagion. So she's both a pariah within her relationship, which is a major support to her, and she's a frontline person working at grave risk to herself. So, we're asking an incredible amount from these people, and I think we need to celebrate them. I love the rituals where some people are, applauding at a certain time of day, or putting hearts in their windows and sending these messages of support. I love when the crafting community lent a hand in making masks for probably not frontline workers who need the N95 mask, but others, so that the N95 mask can be reserved for the frontline workers. I think we need to be coming together as a community and drawing strength from that shared purpose. And I think that will go a long way towards supporting the frontline workers and acknowledging the incredible challenges that they have. And then trying to figure out, how do we message that to their children? Part of it is if we can help them to take care of themselves, then hopefully they'll be in a better mindset to care for their children. I know that many communities have opened up child care centers specifically to support the children of frontline workers. And so hopefully helping to steer them towards those resources and supports so they can do the incredibly important work that they're doing in keeping us all safe and taking care of us. But not having to make choices between their parenting responsibilities and their work responsibilities. I just am so awe and appreciative of the incredible sacrifice that those folks are making.
Liz, I know that we're almost at time. I just want to, I saw something go by in the chat that I think is really, really important. Someone was asking about supporting very new parents during this time. And I, have also been in conversations with folks that are, women that are preparing to be parents very soon, and being told that they have to go into the delivery room without their partner or family members. So thinking about, again, grief or trauma during pregnancy is a clinical indicator for postpartum stress and anxiety and depression. And so I think being, again, as we've said throughout this conversation several times, more proactive, but not alarmist, but certainly, connecting and having screens around some of those things, and having conversations about, if these symptoms escalate, let's have a plan, would be really important there.
Kate, I was just going to ask you that, so that's awesome. Thank you. Okay, we only have a couple minutes left. I'm wondering if we could just take 1 minute per panelist just to give us your final thoughts. Why don't we start with you, Kate?
I think I'll end where I just did. Thanks, everyone.
Linda, do you have some final thoughts for us?
Just final thoughts, I think, with regard to, the conversation we've been talking about and the increased stressors for families, especially those with young children, when we're talking about health equity concerns, trying to encourage this, self-care and support people to reach out to their friends, even virtually, and their support networks. And also to, as we're working with families, to really kind of listen to what they're experiencing and try to support them in that way as much as possible. Thanks.
Thank you. Christopher.
Well, I think you started off by mentioning this, Liz. In crisis, there is opportunity. And so how are we going to leverage this crisis to advocate for what we all know these families and young people need? How do we capture narratives or qualitative data, but maybe even some quantitative data about the ways in which these novel approaches may actually be things that we want to sustain after the pandemic? Some families may actually prefer to have these kinds of supports provided virtually. And so what are the strategies that are working that we might want to sustain? And then begin to tell those stories either in an anecdotal way, a qualitative research way, or a quantitative research way.
Lauren, let's finish.
Yeah, sure. So I know we are just about at time. I would just say, I think we've talked about this a couple times today, but when we are working with our very young children and families, always have that advice of keeping your detective hat on. Young kids express themselves in lots of different ways, and it might not always be the way that we think. So be looking for those clues and always wondering what might be at the root of that problem. And please just remember to seek out help and support and resources. And yeah, thank you so much for the time.
Wow. Denise, you want to take us home?
I will. Thank you, Liz. On behalf of the Institute and the TA Network, I want to thank all of you for participating today. As Paulette said in the chat box just now, it's great to spend this time with everyone, and we do appreciate that. Both our panelists and all of your active sharing in the chat box have demonstrated that together we are truly stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. Thank you for your commitment to the infant and early childhood populations, and please continue to take care of yourselves while you take care of others. Thank you.